Hi, I'm Dr. Breanne Kelley with the Airrosti Rehab Centers, and today we're going to be discussing shoulder bursitis. First, we're going to be talking about some of the causes of this condition. Then we're going to be discussing some of the signs and symptoms that might indicate that you have shoulder bursitis. Additionally, we're going to review how traditional healthcare approaches these injuries and how Airrosti is a little bit different. So let's get started. So shoulder bursitis is not actually a specific diagnosis. It is a symptom of a larger problem within the structures of the shoulder. And to understand what shoulder bursitis is, we need to know what a bursa is. A bursa is a closed, fluid-filled sac. And we have 6 of these in the shoulder that help to provide cushion and prevent friction between the structures of the shoulder. Now let's go over some of the causes of shoulder bursitis. So this condition is typically an overuse injury that starts with bad posture, meaning that we now have poor positioning of the shoulder, causing impingement of the muscles and ligaments. We then combine this with repetitive tasks like manual labor, weight training, or sports like baseball and tennis that irritate the bursa and cause inflammation. Now let's discuss some of the signs and symptoms that might indicate that you have shoulder bursitis. Pain is typically worse first thing in the morning when you wake up, but can diminish once you get that shoulder moving around and warmed up. Pain is typically described as a constant aching sensation and can be associated with swelling and even pain with applied pressure. Pain is exacerbated when the arm is moved overhead, but can diminish once we get that shoulder set back into a proper position and repeat the motion. Now let's discuss how traditional healthcare usually handles shoulder bursitis. Typically, this is handled conservatively with non-steroidal anti-inflammatory drugs that you can get over the counter, or topical analgesics, which usually come in the form of a cream or spray to be applied directly to the skin. In more serious cases, a steroid injection may need to be administered, or potentially pain management medication. Now let's talk about how Airrosti is a little bit different. At Airrosti, we spend a full hour with patients and perform a thorough evaluation so that we can get an accurate diagnosis and get to the root cause of your pain. We then perform specific hands-on manual therapy followed by active care with specific exercises and stretches that you can do at home to maintain the progress made during treatment. Thanks for watching. We hope that this information was helpful to you, and if you or a loved one is experiencing shoulder bursitis or any other pain, please click right here to schedule an appointment today. If you'd like to check out some of our other videos, you can click up here, and don't forget to subscribe to our YouTube channel. We'll see you in the next video.